So, according to the ICHD-3, the International Classification of Headache Disorders, there are 7 official types, and this is one of them. So there's migraine with aura and migraine without aura, and those are the 2 most common types, right? And then there's migraine without headache, which most people are shocked to hear about.
Yes.
Right? Can you explain a little bit about that one?
Absolutely. So migraine in general is a very diversified experience and disease. Each individual can have the same classification of migraine, but experience and present in very different ways. And so migraine without headache is one of those unique factors where if you're not looking at your overall symptoms, you probably won't even think about the fact that you're living with migraine. And in fact, that's why most people aren't getting diagnosed appropriately, because the perception in the world is, well, you have to have a headache, you have to be in pain, and if you're not having those classic symptoms, that's the migraine without headache category, and one of those elusive areas of the disease as well.
Migraine does not equal headache.
Exactly.
Yes, exactly. And some people call it silent migraine. In fact, that's one reason why we use language like migraine attack now, or migraine, instead
Correct.
of migraine headache.
Exactly.
Because we're trying to separate the two so that people understand this isn't just a headache.
Exactly. In fact, before my diagnosis, I was thinking about headache in a completely different way. And why am I getting these headaches? Since my diagnosis, I've completely moved away from that language and that association, because I want to make sure that my experience living with migraine disease is seen as something different and as a disease, as opposed to when we all face the public perception of migraine as just a headache, which is not, as we all know.
Right. As Dr. Peter Goadsby would say, it's a disorder of the brain.
Yes.
It's not just a headache.